Hi everyone, my name's Linda Burney. I'm the federal member for Barton, and in my portfolio of responsibilities I have the issue of family violence.
My name is Anne and I'm the federal member for CALD.
How are you, Anne?
I'm good, thank you, Linda. It's so lovely to see you, albeit through a screen.
There's such a heightened level of stress in many homes. People have lost jobs, particularly in the CALD community where a lot of people were casuals. And if there was an existing violent relationship, then it makes it even more difficult. And we can't forget, Anne, of course, the children.
Yeah, you're absolutely right. And, we were dealing with high rates of family and domestic violence in Australia even before the pandemic. And self-isolation kind of magnifies the danger of the experience for many women and children in these situations. But it also might create new situations because of the stresses that you speak about, where women and children will be subjected to family and domestic violence. And for a lot of the women and indeed the children, those outlets that they had for the children being able to go to school and get away from that, and for the women, having their partner who may be an abuser leaving the home to go to work.
There are certainly language barriers which are really important, a very different cultural context to many of the services that are provided. And people want to feel safe. Women from a linguistically and diverse background feel safe if they're in a culturally appropriate situation. And that's not necessarily going to be available because many of those services are local services. And I want the government funding to reach those local services. I was talking to the Muslim Women's Association in the area that I work in, and that organisation is a small, locally based organisation that isn't one of the great big outfits, and it does such important work for women from that particular community, that particular cultural background, and they understand what the needs are. They understand the way in which those communities operate.
But they are women who are doubly isolated. They're isolated within their homes, but they're also isolated within the broader community as well. And those services are particularly important for reaching those women who are in those situations. And I would also add from my own personal experience, plus from the experience of women that I've spoken to, for a woman in some culturally and linguistically diverse communities, for a woman to leave the family home, there's a lot more that comes around it. There's lack of family support, and they face also being ostracised by their own communities as well.
I don't think there is enough support. It is also making sure that health providers understand multiculturalism. It's about the services that those women come into contact with, whether it's the pharmacy, whether it's the emergency department, whether it's the family doctor, whether it's the local, the faith leader in those communities. They're the people that need to be also given support to recognise the signs.
Absolutely. I remember thinking, well, I had nowhere to go. That's why I didn't leave. And I know that's the case for many women out there, that they feel like at the very least they have nowhere to go. But that point that you make about, supporting the support services, the medical profession, the pharmacists, the religious leaders, and those who are in a position, who have contact with women who may be experiencing family and domestic violence, to recognise the signs and to be able to provide some level of service to them. That's a really important one.
I think for people like you and I and the rest of our colleagues who are local members of Parliament, have an incredibly important role to play here. We know our local communities, we understand them, we've got connections with those organisations. So it's about supporting those organisations and saying very clearly to government, these are the sort of considerations that you need to think about funding local organisations.
But it really is important that we keep the conversation going, because the more we talk about it, the more likely we are to reach that 22-year-old Anne Ali stuck away somewhere, who, you know, doesn't watch Question Time and, you know, doesn't watch you know, what's on television when politicians are speaking. So the more that we speak about it and the more that we keep the conversation going, the more likely we are to reach those women who at the moment are unreachable. Thank you, Linda.
Thank you, Anne.